Let's explore a case and walk through what types of assessments we would use and maybe why. What we'll do in this exercise is review a case, talk about what the person says in their initial session, think about the case, and then we'll walk through what types of assessments we might want to utilize and why. So first, let's talk about Sally. So Sally comes to you and she is 45 years of age. She's recently separated from her spouse of 20 years. She reports having, and these are her words, scattered thoughts, difficulties focusing, jittery feelings, and she needs to get back into the workplace, or she's wanting to get back into the workplace because she's got the divorce that's coming up. She recently separated, and she's got 2 teenagers who will be heading off to college within the next couple of years. So these are some things that you find out in your initial meeting with her. So you've talked to her, you've seen her, and now we want to really kind of think about what all else is going on with her. When you review the paperwork that you had her fill out on that initial meeting, she filled out a biopsychosocial history form. And through that, this is some additional information that we know about Sally. So she reports having somewhere between 4 to 5 alcoholic beverages a week. She has had a death of a parent within the past year. She has another aging parent that she provides some care for. And she also has an older sibling that has some mental health issues and addiction issues. So why is this important for us to really pull out of that biopsychosocial form? It's very interesting to look to see about the alcoholic beverages that she's drinking. She doesn't report any problems or mentions anything during your discussion, but you do note that on the form when you're reviewing it later. You see that there's the death of a parent. She still has another aging parent that she's doing some help for, but we know these are some additional things that are happening and going on outside of what she's already told us. So when we think about Sally and how we would work with her, so let's explore some considerations when working with this client. So what are some of those potential areas that you want to work with Sally? What is it that you think about that we might need to assess with her? So not only like what would you explore, but why would you want to explore those potential areas? So think through that. Pause the recording here if you need to, or go back to take a look at what all was happening and going on with her and think about what is it that you would want to work with. Identify those different areas that you may either need to get some additional information about, what is some things that you may want to do an assessments on, and why. What is your reasoning behind that? You need to know the why, just not necessarily because. And I have down here, like, think about your differential diagnoses. And what I mean by that is when you are considering a diagnosis for this person, and you may not necessarily have to write that diagnosis or utilize that diagnosis or submit that diagnosis to insurance, but you do need to narrow that down or identify that, because this is going to help you with your treatment planning. It's going to help you with the interventions that you do. It's going to help you really be able to work with Sally in a more depth that could be beneficial for her. And so the differential diagnosis is all of the different diagnoses that this could be, all of the things that you're considering, because you want to consider all of these options and then slowly start to rule them out. And this way you can look at not only the initial things that are presenting, but then also these other additional diagnoses that may be co-occurring that you also want to include with your diagnosis. You may need to take focus on that because they could be exacerbating the other. So take a little bit of time, think about like what all you would work with her for, what all types of diagnoses do you think that there could be for this person? And think in that big broad category, what may be happening from a mental health capacity? Is there something that may be happening from a health capacity? Is there some kind of developmental issue that may be happening? Is there cognitive difficulties that you're taking note of? Are there any type of substance or alcohol use or abuse, medication abuse that may be happening or going on? So you really want to think about all these different categories for your diagnosis to get that bigger differential diagnosis. What are you thinking could be a possibility for this person that you want to either rule in or also rule out? So here's a list of some things that for me stand out in working with Sally. First off is that anxiety. She's talking about having those feelings of being jittery, of not being able to focus. So, and then there's a lot of stuff that's happening in her life that could naturally cause some anxiousness there. There's some grief or loss, like her marriage is ending. She lost a parent within the past year. She's got children transitioning out of the home. She's like loss of her primary roles as a wife, as a homemaker. And not even to mention that, there may be some other issues of loss that may be occurring there as well. But there's a lot that you could just easily list off there. There's some substance use that's happening. She's reporting that she's drinking 4 to 5 alcoholic beverages a week. I definitely would want to explore that more because we know that people have a tendency to underestimate and underreport what it actually is that they're drinking or using. So her use may actually be higher. We also want to find out, to do a definite screening. Is she talking about a drink like a shot? Is she talking about like, a regular 4-ounce glass of wine? Or is she talking about like a 32-ounce tumbler and she has 4 of those? So it's really, you need to get some parameters around that. I definitely would want to do some screening and get some additional information about that. Career or work consideration. How long has she been out of the workforce? What did she do? Is she working currently? Does she just need to change things? Because she knows she wants to get back into the workforce in what type of capacity? So there's a lot of career options that you could explore with Sally as well. I would also consider depression. You can still have some of the feelings of not being able to focus, those jittery feelings, that anxiousness that can come with depression. Definitely something that I would want to rule out or even rule in. So with the also grief issues that may be happening and going on, there could be some depression that's happening. There could be some anxiety and depression as well, which is why she may be drinking at the rate that she is. There can be some relational adjustments. So her husband, or she's going from her husband or a spouse to an ex. She's moving to a single parent and co-parenting partnership. So that relationship's changing. She's going to have parent-child adjustments because of the separation, the divorce, with the kids going into school, and then just new roles that everybody's going to be having. So there's a lot of a time of adjustment that's happening there. So I really would want to do some diving in there to explore what's happening, what's going on there. And then from a caretaking perspective, she's got an aging parent. She's got an older sibling that's got some mental health and substance issues. So how large is that role that she's taking? Is she really providing a lot of care? Is she just overseeing? How is that other parent doing? Plus, there was that recent loss of parent. You may want to explore what that relationship was like between the parents. Were they together? Is this more of a significant loss to that other aging parent? And then there's creating this new life as a single or a divorced person. So that is another consideration to take, like what kind of changes that's going to bring up into her life in general. And then always, I have it lastly, but I would say it's probably most importantly, the suicidal ideation and homicidal ideation, you always want to assess for those. And not knowing what's happening or going on with the divorce or the separation, you definitely want to assess for both suicidal ideation as well as homicidal ideation. So very important things to consider. So how would I transition that into some formal assessments that I would want to do? So when I'll talk about just a couple here. For example, for anxiety, if I wanted to talk to her a little bit more about her anxiety, that is great. This is what she's coming in reporting. So I may want to give her the GAD-7, that general anxiety disorder scale, because that is something that we could have her take whenever we do meet, or maybe once a month, to see where her anxiety is currently and then how it may change over time. You could also explore that same type through Beck Anxiety Inventory, through HAM-A. You could maybe do partial collection of that. It's that anxiety rating scale. So you can at least collect some information about her anxiety. You can use the State Trait Anxiety Inventory or the Multidimensional Anxiety Questionnaire. So there's several formal assessments that you could use to check in with her anxiety. From an informal perspective, you could ask about where her anxiety levels are, work on what the scaling would be for her. Like if you're using a scale of 0 to 10, what does that look like for her at like a 1, a 5, an 8, a 10. So then you can have her assess her level each time you speak with her. From a depression standpoint, you could have the Patient Health Questionnaire 9, the PHQ-9. You could have that assessment, and you could do that again each time she comes in to meet with you, or maybe once every 2 weeks or once a month. You could do the Beck Depression Inventory. You could do the Hamilton Depression Rating Scale or a Clinically Useful Depression Outcome Scale, the KUDOS. So both of these, you want to use tools that are sensitive to each one of those different types of diagnoses. So this way you could, like I said, rule out or rule in, because we know that there are some symptoms of anxiety and symptoms of depression that really overlap. So you have to tease out, is this anxiety, is this depression, is this a combination of the two of them? So there may be, it's very possible it could be both, and it could be either or. The assessments will help you tease that out a little more in depth. And then here are two others that you could explore for potential formal assessments. You could explore that substance use and abuse for her alcohol. Probably would look at that audit, which is the Alcohol Use Disorders Identification Test, or the Michigan Alcohol Screening Test, the SBIRT, the DAST-10, the Global Assessment of Individual Needs, the SASE. So you could really screen, you can screen for substance abuse, and then if that screening comes back where, yeah, there you need to explore this a little more, then you could dive deeper with a different type of assessment. So that way, if you screen, you can really rule that out and know, okay, maybe this is just during this time frame. It's a coping skill that she's utilized because this isn't how she's been for a long period of time. Maybe this is just how it's been for the past maybe a couple of weeks. Maybe this is just happening during this separation. So you could screen for it, which is that higher level, just to let's talk about it and really kind of find out, do we need to go and explore more deeply? A screening would be very appropriate in that aspect. And then if you realize with the screening tool that yes, there's something, there's definitely some abuse that's happening, so let's assess a little more deeply. And then with the grief and the loss, there are assessments to go along with that as well, because we know that she has had some bereavement and some loss experiences. You could do a grief intensity scale. You could do a brief grief questionnaire. You could do a coping assessment for bereavement and loss, complicated grief assessment. So she's got a lot of stuff that's happening and that's going on. And some of the things are it's that regular grief that we all understand. Someone passed away, someone died. There's a significant loss like a divorce or separation. But then there's some of those ambiguous losses that she may be having, like she could be having a change. You know, she knows that upcoming empty nest is happening, so that's going to change. There was a loss of her role as a child. She still is a child because she still has a parent that is alive, but that is shifted into where she's doing a caretaker role. So there's an ambiguous loss there. So there's a lot that you could assess for in that aspect to see if that is something that can be contributing to depression and anxiety, or if this is like really that main diagnosis, that if she's having some extreme grief, that could be, this is just her adjustment period. Other considerations, safety. Safety is always first and foremost. I would assess for suicidal ideation, homicidal ideation, substance abuse. You could also assess for that intimate partner violence, because there is this separation and divorce that's happening. We don't really, at this point in our discussion, we don't really know the details about the separation or the divorce. So that may be something that you would explore. Has this soon-to-be ex, this spouse of hers, you know, has there been some intimate partner violence? Is that something that we need to take into consideration of? Is she the one that left the home? Is that one the one that left the home? Has this happened before? So there really can be some IPV stuff that you can dive into. I also would be curious just to make sure about the safety, because there are children involved, and make sure that they are safe, because although they are teenagers, they are still children under, you know, minors in the home, and you do want to make sure that they are safe. And the same thing with her elderly parent. We're not sure whether that she's providing some of the care for them. Are they living on their own? Are they safe? Are they, you know, was the other spouse the one that was taking care of them? Like, what, maybe find out a little more information about that. Ethically, those are populations of people that we do need to kind of keep an ear out for. We are mandated reporters, so we do want to make sure that the elderly and the children, and even the sibling, if there's some, depending on the level of that mental health issues that they have or is going on, like if they are still in the home or under the care of someone else, are those people, are these protected groups of people, are they safe? And then career. There's a lot of places to explore with her, just for her career exploration, for her education and readiness. You know, does she have education? Will she need education? And her training, what skills does she have? What could she utilize? What has she been doing in the past? How ready is she to get back into that career? So you really want to kind of also establish that readiness for change in that aspect. And then her changing lifestyle. There's a separation, a divorce that's coming, loss of a parent. She's a caregiver. She's got upcoming empty nest, which could cause a whole other set of things, because that's another change that she can see coming. Going back out into the working field, that possibility that she might start dating. And then there's that potential of a changing home. Like she may have to move, she may have to relocate. She may also have changes in income. If they were going from, you know, a different income, and she's now having to step in as that primary income driver, that could be a switch or a change. Is she used to managing the whole household by herself? What are other things that you can think of with this client? So take all of these things into consideration, but what else would you think about? Hopefully, when you sit down and take a bit of time with the client, once you've talked to them, once you've reviewed their paperwork, it can even be helpful if you map this out, whether you do this in your head or you actually do it on the computer or with paper, to think about, like, what are all of the things that I need to think about, especially when it comes to a differential diagnosis. So all of these things that you want to think about that can help you figure out what is happening with this person, how you can meet their needs, how you can help them, and what course of action that you're going to take with your treatment planning. And how do we use assessment in all of this, right? So with this, we could use our assessments to monitor her progress. So if we know that she's coming in a particular state and frame of mind, if we assess her where she is right there, then we have a baseline of how she is at this apex of, when she's coming in for treatment. And then you can monitor that process, because hopefully that scores will get to be better, that she'll be able to report less anxiety, she'll be able to report increase in mood. So you can track those changes. You can use those assessments to assess for safety. You can assess, her alcohol use. You can assess for suicidal ideation. You can assess for homicidal ideation. You can assess for safety of other people that are involved in her life that may need to have that protection. You can assess for need. If you're working with her from a career perspective, what are some of those needs? What do you need to do as far as if she's, is she going to have to make changes in her life? Is she ready for those changes? What steps are she taking? And that can also lead you, all of these things can lead you to what your diagnosis of your client, of what is that diagnosis for her or that person. And then how are you going to, you can use those assessments in that treatment planning. How are you going to create goals? How are you going to come up with interventions that will help you meet those goals and have that success and change? And then you also, of course, you can use those assessments to look back to see, is the work that you're doing with her satisfactory, and whether that is you looking back to track those changes and to make sure that you are providing good services for her, or for her to look back to say that she is receiving the treatment and that's effective and helpful for her. So assessments can be used in a lot of different ways to help us throughout that stage. Keep in mind, though, when you are using assessments, you don't want to overstress your client. You're not wanting to do a barrage of assessments where you come in and you're like, okay, you've stated 6 different things, so now I want to do these 6 different assessments on you, and we're going to do those every time you come in, or we're going to do this barrage of tests. And while that may be helpful to find out some information, use them judiciously, use them sparingly, use them wisely. So if you're not sure that there may be, anxiety or depression, talk with her a little bit more. You can do some informal assessments. You can ask some of those questions that may be on each one of them. And then if you're leaning much more towards depression, that would be the time. Let me go ahead and this is where I'm leaning more. That's what your clinical intuition is telling you. Then explore the depression inventory. So then that way that can confirm your suspicion. Also, you're going to be matching all of this up with the criteria in the DSM, so you can see, is this person meeting the criteria for depression, and can you confirm that? If even if it is just with what she's reporting, but you also do want to confirm that, especially when you're having those diagnoses or those symptoms that overlap with each other, because it can really help you hone in on a particular diagnosis. Is this depression? Is this anxiety? Is this bipolar? Is this a personality disorder? Because so many of those symptoms do overlap. Is this just an adjustment disorder and grief? And it's just something, this is the stage of life that she's in, and she may be experiencing these, but she's not meeting that criteria for it. And it is just more of an adjustment that she needs to have assistance in navigating with. So for example, on this case with Sally, my differential diagnoses would be anxiety, depression, adjustment disorder, substance use, or alcohol abuse, and I probably would want to potential bipolar or personality disorder. There's certainly a lot more questions that I would want to talk to her about. The personality disorder may not necessarily be anything to consider at this point. Definitely many things that I would have on my differential diagnosis in working with Sally. There are quite a few things that I would want to rule out. Some things may be a bit of a reach at this point, but I would rather have that in my working. That's exactly what the differential diagnosis is. It's your working diagnosis. I'd rather have those floating around and for me to be able to rule that out for sure than for me to miss that, because it's just not something that I considered in the very beginning. But it gives me things that I am like, these are all of the things that I think it could be. And over the next session or so, I'm going to really be honing that down to rule out and rule in what may be officially happening with her from a diagnosis standpoint.